What's up with y'all out there? This is Best Way to Smoke Weekly News, and I'm Big Jake. Make sure you stay elevated at all times. It's 4 states that are going to be allowing medical cannabis inside hospital facilities, which I think is a great move on behalf of them states that's going to allow this to happen. So, in early 2026, a new wave of legislation, often called Ryan's Law. Some people that's advocates in the cannabis industry and especially in the medical realm will understand what Ryan's Law is. It's sweeping through several states. These bills aim to give terminally ill patients the right to use medical cannabis within healthcare facilities like hospitals, nursing homes to manage pain and improve the quality of life. The big 4 states that's making the move to advance with the legislation. First, we got Colorado. The Senate recently approved Senate Bill 26-007, which allows but does not mandate healthcare facilities to set guidelines for medical marijuana use for terminally ill patients. It passed with strong bipartisan support, 25-5. So that just shows that how a lot of the research that's going on with medical cannabis, with cannabis period, is proven that it helps and it's beneficial. So we also have Washington is actually on the same trend. The House passed HB 2152, which would require hospitals and hospice centers to allow terminally ill patients to use cannabis starting in 2027. It's now heading into the Senate. And, shout out to the people in office that actually pushed this along to get this going. You know what I'm saying? Especially for terminally ill people and people that's dealing with certain things to where, medicine might not be helping, or medicine might be helping, but it's causing something else to go wrong. You know what I'm saying? So then we got Virginia. Virginia lawmakers have advanced bills like HB 75 that protect hospital workers who help seriously ill patients access cannabis oil. They're also looking into expanding the types of products allowed. So what that means is they want, instead of just using the oil, they want to get into the edibles and stuff like that. I don't know how much it's going to be as far as with the smoking cannabis, but we're going to talk about that later on in this news segment. And then we got Hawaii. Legislators are pushing for a policy change to ensure patients don't lose access to their treatment just because they've been admitted into a hospital. So what that says, it's a lot of people that's actually using cannabis that's not in the hospital. So, and that wants to be able to go to the hospital and still have a use of cannabis. So it's actually dope that they're restructuring a different way for people to be able to have access to cannabis because it proves that it helps. So on that note, this is how it's going to work. This is the fine print right here, y'all. This is like some of the most important parts of what's going on. So while the rules vary slightly by state, most of these bills follow a similar common sense framework. No smoking or vaping to keep the air clean and oxygen safe. Patients must use oil, edibles, or pills. Now, to the point of what I said last week, with all this research is going on and with Big Pharma making the play to get into this thing, them pills, they're going to have it in a pill form, Look, so staff doesn't touch it. Generally, doctors and nurses won't prescribe or administer the cannabis. The patient or designated caregiver is responsible for bringing it in and taking it. So that's interesting. It won't necessarily be prescribed by the hospital to where they're bringing it, but you're able to actually still get access to it and able to use it while you're in the hospital. So locked and loaded, the cannabis must be stored in a secure, locked container within the patient's room. The federal escape clause, because marijuana is technically illegal at the federal level, which we know, this bill includes a safety valve that lets hospitals stop the program if the federal government threatens to pull funding. So it's going on. So that's the catch. That's a catch to it, though. You know what I'm saying? So if the federal government start tripping, then the hospitals have a time frame to get them policies about the way, so they can continue getting their funding. Why this is happening now? That's a good question. The movement is inspired by Ryan Bartell, a California man whose family had to move him to a different facility in his final days just so he could use the cannabis that was finally managing his terminal bone cancer pain. This new bill aimed to prevent other families from facing the same hurdle. So Ryan's Law is a big thing. You know, Ryan's Law is a big thing in the push for medical cannabis to get it to terminally ill patients. So on the note of what's going on, man, us at Best Way to Smoke, we feel like it's a good thing that it's advancing in this way. You know, and to everything that happens, there's always pros and it's always cons. But right now, we're gonna focus on the pros of what's going on. So shout out to Colorado, shout out to Virginia, shout out to Hawaii, and shout out to Washington for moving in a way to further cannabis research and to further cannabis acceptance and use for terminally ill patients, man. This is Best Way to Smoke News. Make sure you stay tapped in with us. I'm Big Jake. Make sure you stay elevated at all times, and we'll see you next week, man.